Ever pondered the significance of your respiratory system? This intricate network of organs and tissues enables the vital process of respiration, allowing us to inhale oxygen and exhale carbon dioxide. But what happens when the system doesn't function as it should? Today, we delve into the world of respiratory disorders, their causes, symptoms, and treatments. First up, we have asthma. This chronic condition inflames and narrows the airways, leading to periodic episodes of wheezing, chest tightness, shortness of breath, and coughing. The exact cause of asthma remains unknown. However, a combination of genetic and environmental factors seems to play a role. Exposure to allergens, certain irritants, or even physical exercise can trigger symptoms. Treatment typically involves the use of inhalers to relax the muscles around the airways, making it easier to breathe. Next on the list is chronic obstructive pulmonary disease, or COPD for short. This term refers to a group of diseases including emphysema and chronic bronchitis that block airflow and make it difficult to breathe. Smoking is the primary cause of COPD, but long-term exposure to chemical irritants can also lead to this condition. Symptoms include shortness of breath, wheezing, and chronic cough. Unfortunately, damage from COPD is not reversible, but treatments and lifestyle changes can help slow the disease's progression. Then there's pneumonia, an infection that inflames the air sacs in one or both lungs. Bacteria, viruses, or fungi can cause the disease. Symptoms range from mild to severe and can include cough with phlegm, fever, chills, and difficulty breathing. Antibiotics can usually treat bacterial pneumonia, while viral pneumonia often resolves on its own with rest and fluid intake. Lastly, we have pulmonary embolism, a blockage in one of the pulmonary arteries in your lungs. This serious condition most commonly results from deep vein thrombosis, a condition in which blood clots form in veins deep in the body. Symptoms include shortness of breath, chest pain, and cough, sometimes with blood. Treatment typically involves medications to dissolve the clot and prevent new ones from forming. To sum it all up, the respiratory system, while incredibly efficient, is not impervious to disorders. Conditions like asthma, COPD, pneumonia, and pulmonary embolism can greatly impact the system's function. Understanding these disorders, their causes, symptoms, and treatments not only broadens our knowledge, but can also help in early detection and effective management. For now, remember to take care of your respiratory health. After all, every breath you take matters.